Hey, hi everybody. We're just going to wait another couple minutes for a few more people to come on, and then we'll get started. Okay, so I think we'll start now. It's time for us to start our talk on desire this evening, and I really want to thank you for spending some of your Tuesday night with me. My name is Grace Meehan, and I'm a pharmacist, and I work at Nutrichem Compounding Pharmacy, but I'm also a NAMS certified menopause practitioner. NAMS is the North American Menopause Society, and it's a group of leading experts in the field of women's health from midlife and beyond. Now, for me, my story is that I was working in a busy pharmacy about 8-9 years ago, and I found that a lot of women had questions about their health, about their menopausal health, and they were asking me for answers, and I honestly felt ill-equipped to answer their questions, which wasn't a good feeling as a pharmacist. So I realized I had a knowledge gap, and I thought I'd got to do something about this and get some answers. So I discovered the North American Menopause Society, and I joined them, and I went to their conferences, and I wrote their exams to become a NAMS certified menopause practitioner. So what I do now is I meet with women usually on a one-on-one basis, and I answer their questions, help with their symptoms, and formulate a plan, like an individualized plan for them, for their health, which is really fun and really rewarding. I also work as a pharmacist, though, at Nutrichem Pharmacy, which is also fun and rewarding. For the men in the audience, you're going, oh darn, this is going to be about menopause. Please stay with me, because a lot of what I have to say about desire pertains to both men and women. So please stay tuned. My outline for tonight, we're going to talk about what is sexuality. I'm going to go through some definitions. We will talk about the benefits of sex, the factors that affect libido, and this is really going to be the meat of my talk tonight. And also, what's the role of testosterone, and is it the answer? A lot of people think that, if I have a desire issue, that it's got to be the testosterone. That's the problem. So I'm going to speak to that, and we'll come up with, hopefully by the end of my presentation, you'll have an answer to that one. So let's get started. What's sexuality? And this is basically the dictionary definition. Sexuality is how we experience and express ourselves as sexual beings. Human beings are sexual. This is a rather busy slide, and I apologize for that, but I'm just trying to highlight a couple of differences here. The first definition, hypoactive sexual desire disorder. This comes from the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. Hypoactive sexual desire disorder is the most prevalent sexual disorder for women of all ages, but it affects both men and women. It's a deficiency or absence of sexual fantasies and desire for sexual activity. So deficiency or absence. It may be lifelong or just after midlife. It must cause marked distress or interpersonal difficulty. And it's twice as likely to have declined health status. So something else is going on. There can be fatigue, depression, back pain, chronic pain, memory issues. It's differentiated from normal. Each woman and man has their own definition of what is normal sexual desire based on culture, based on background, and based on sexual experience. So we kind of are where we came from. The decline in desire with normal decrease in sexual function, the decline in desire over time may be modest and not be a major problem. There are benefits of sex. What are the benefits of sex? It helps sleep, decreases stress, and those are such common issues right now. Sex can help with pelvic floor muscles. So we're talking about bladder here. We're talking about prostate health. Sex has been shown to decrease blood pressure and cardiovascular disease. It improves mood, and it improves intimacy. So all of those things, they sound really quite good, right? So what's the big problem here? If it's all so good, that sounds great. Well, the problem is that people do report having sexual problems. And sexual problems generally increase with age for both men and women. The distressing symptoms for women peak at midlife, and very interestingly, are lowest after the age of 65. Desire declines with age in men, but less so than in women. And symptoms that are reported are decreased desire, decreased arousal, decreased orgasmic response, and increased sexual pain, and that's in women. Now, decreased desire is really what our topic is about tonight. The Massachusetts Women's Health Study. This was a large population-based study, and I really want to highlight this. It showed that a woman's menopausal status has a smaller effect on sexual function than factors such as health, socio-demographic factors, psychological issues, a partner's health and lifestyle. But hormonal status can play a factor. So there's lots going on. I like this just because it's a remote control that kind of illustrates that there's many factors that are important for good sexual functioning in terms of libido. So it's not just one button that has to be pressed for us. Many things have to be aligned. So let's get into the meat of what I'm talking about tonight. There's factors that affect libido. And you might groan at this when I say what we eat and our weight. It's important. But you might groan, but stay with me on this. Hormones and vaginal health for women. Sleep, stress, mood and energy, medications, and importantly, our relationship with our partner. Kind of cool that when we work on some things like sleep, stress, what we eat, etc., our relationship with our partner can actually improve. Okay, what we eat and our weight. I really want to emphasize this one. What we eat. We need to clean up our diet. I've written eliminate sugar and processed sugary foods. Well, why? Because when we eat sugar and processed sugary foods, what happens in our body is that as soon as we eat the sugary stuff, we have an increase in a hormone called insulin. And what insulin does is if it's always high, it has a negative effect on desire. We might say, I don't eat sugar and these sugary foods, so I'm okay. But if I quizzed you a little bit, you may say, well, yeah, I like bread, and yeah, I like pasta. Well, what happens with those things is they immediately get broken down into sugar in our bodies. And so it's the same type of effect. When we have high insulin, then we have decreased desire. When we have high insulin, it also decreases our mood, our energy, increases our risk of diabetes, and increases our risk of cardiovascular disease. Since the 1980s, North Americans sort of adopted a low-fat diet, right? We were told that that was the healthier way to go. But what happened when we incorporated a low-fat diet? We started to increase more carbohydrates. Food manufacturers took the fat out, but replaced it with sugars that would taste good. And what's happened since the 1980s, we're seeing more health issues for people, right? There's more diabetes, more issues with mood, more issues with cardiovascular disease, etc. Watch alcohol. So we think that alcohol can help with desire, and it may in moderation, and heavy on the moderation. So one glass of, say, wine makes you feel relaxed, may make you start thinking about sex, but more can crash your mood and your desire. Also, alcohol is a sugar, so it increases your insulin. And when it increases your insulin, it decreases desire. It's a sugar, so it can put weight on. And not only that, alcohol can increase so many different cancers. So again, we've got to be careful of how much alcohol we consume. We need protein. We need protein for energy, mood. We also need protein in order to make serotonin. And I'm going to speak about serotonin more in the next few slides. But serotonin is an important neurotransmitter that our bodies make. And when serotonin is in good shape, it has a positive effect on sex drive. Protein also helps to keep our blood sugar down, which keeps our insulin levels down at a good level. Weight loss. So it's really cool that if we eliminate sugar and sugary processed foods, weight comes off. So I'm not advocating any specific diet here, but from the journal Obesity in 2012, it states obesity is associated with a lack of enjoyment of sexual activity, lack of sexual desire, difficulty with sexual performance, and avoidance of sexual encounters. And oftentimes it's because obesity is associated with high insulin. The Journal of Sexual Medicine study in 2013, there were two groups of overweight people. So they had two groups of people. One group of overweight people were in the exercise and weight loss group, and the other group were in the placebo group. So they didn't get the exercise and the weight loss. And what was found was that the people in the exercise and weight loss group had better sexual function scores. They all improved. Okay, your gut-brain libido connection. Did you know that there's a gut-brain libido connection? Well, there is. Have you heard of the term the microbiome? It's kind of all the rage right now. That word is out there. The microbiome, in case you haven't heard of it, it's about 2 to 5 pounds of bacteria, fungi, phages that live in our gastrointestinal tract. And it's really important because the microbiome affects our ability to digest food, to absorb important nutrients, and to make serotonin. When serotonin is in good shape, we're relaxed and we have better sex drive. This gut bacteria microbiome produces enzymes, hormones, neurotransmitters that affect libido. And that gut microbiome is responsible for production of 90% of our serotonin. 90% of serotonin. We used to think that serotonin was just made in the brain. No, 90% of it is made in the stomach. So if there's not enough supply of serotonin due to poor gut health, sexual desire and function can be negatively affected. Like, how interesting is that? Do you suffer? So we're talking about the gut still. Do you suffer from bloat, gas, constipation, diarrhea? Have you been told that you have irritable bowel syndrome? These are not normal states for the stomach. Commercials might tell us that they are, and that you can just pop a pill and get rid of all of these symptoms, but that's not the case. If you're suffering from these things, it's a sign that there's something going on in your stomach and your microbiome is most likely disrupted. Are you taking acid-reducing medications, right? For heartburn, for acid reflux, they're all the rage. Are you taking them? Well, long-term use of these have been shown to disrupt the microbiome. We need acid in our stomach. The acid-reducing medications disrupt your ability to absorb important nutrients for your health. So, if we decrease the acid in the stomach, we're not able to absorb nutrients very well. We're not able to do a lot of important things that our body requires to do. What about antibiotics? Are you taking antibiotics? Sometimes we need an antibiotic, right, for a bad bacterial infection. But when antibiotics are used or overused, they can kill a good amount of your gut bacteria, which is very disruptive. So if you need antibiotics, first of all, ask the question, do I really need this antibiotic? Because sometimes they're inappropriately prescribed, sometimes. If you need it, then ask what you can do to protect your gut, to protect your microbiome. Here's an interesting word, the estrobolome. And this is exciting. This is like emerging data. There's a certain set of gut bacteria, that's responsible for metabolizing estrogen in the body. So it takes estrogen and gets rid of the nasty stuff, helps our bodies to metabolize estrogen to good metabolites and not bad metabolites. And when the estrobolome is not in balance, then it could lead to problems with hormones. So do you suffer from PMS? Do you have symptoms of high estrogen, meaning like breast tenderness or heavy menstrual bleeds? Do you have low libido? Do you have acne? And actually, you might think, well, it's just my hormones. Yeah, but why? Well, it may be your gut. So how your gut health affects your sex drive is determined by the health of your gut. So our gut health rules our health. So important. You fix this and so many things can improve. Mood, energy, weight, yes, libido, sleep. People who have chronic pain, there's been studies that show that if you fix the gut, pain can actually improve. So this was I'm hoping I've really driven this home, how important your stomach is. So what to do? Okay, now I hope I haven't confused you. You're thinking, oh, that sounds crazy. What am I going to do now? Actually, it's not that difficult at all. What we say is eliminate the sugar processed food. Get rid of it. There's no nutritional value in sugar and processed food. So eliminate those things to heal the stomach. I've also written down dairy and gluten because in some cases they're hard to digest. And so we'd say eliminate them for about a month, heal the stomach. You can reintroduce them and see how your stomach feels then. Sugar, like I said, eliminate sugar. It's problematic for the Leydig cells in males, and those are the cells that make testosterone. Sugar is also problematic for that microbiome. From the journal, from Science Translational Medicine in 2009, this was an interesting study where the scientists took mice and transplanted fresh or frozen human microbial fecal communities into these germ-free mice. So they put fresh or frozen human fecal matter. And they shifted then the diet for these mice from a low sugar, like healthy plant-based diet, to one that was the Western diet. So they gave them a high sugar, bad fat Western diet. And what happened is within one day, they had shifted the structure of that microbiome in negatively. They'd affected it negatively within one day. We want to watch and minimize our alcohol intake. Remember, think of the microbiome. Alcohol can be disruptive to it. We want to think about probiotics. Probiotics are basically fermented food. So we're talking about kombucha, kimchi, sauerkraut, foods that have healthy bacterial content. And if not, there are probiotic supplements that can be used as well. Well, all that good bacteria in our stomach that does all those important jobs, they need to eat. And that's prebiotics. They need to eat on good stuff. Prebiotics, and what I'm really talking about here is fiber. Bacteria feed on fiber, and our North American diet just doesn't have enough fiber. So we work to incorporate fiber for the health of the stomach. And at Nutrichem, it's very cool right now. We're targeting different good bacteria of the gut with specific fibers that help to feed these specific good bacteria. It's super cool. So the health of your gut is vital. And best thing may be work with a practitioner. Work with a naturopathic doctor. We have two amazing ones on staff. Work with a clinician like Kent McLeod or myself. Work with holistic nutritionists. We have two amazing staff members who are holistic nutritionists and meet with people to show them what to eliminate and to make personalized meal plans for them, which is fantastic. Okay, let's move on to sleep. If I was able to see a show of hands of how many people get 7 hours of sleep per night, how many people could put up their hand? When I've done this with the live audience, there's not that many people. Or maybe you're one of those people that says, well, I only need 4 or 5 hours sleep. I can function really well on that. Well, I would challenge you to say that they may catch up to you down the road. Why is sleep so important? Because it's with sleep that we repair our bodies. It's when we sleep that we make those important neurotransmitters, serotonin. Serotonin is made in our stomachs when we sleep. Dopamine, which is another important neurotransmitter, it's made when we sleep. Sleep improves our vitality. It's important for detoxing. That's when our bodies kind of take out the garbage. Think about a day when you didn't sleep well the night before. How much were you wanting to engage in sexual activity the next day? Right? Usually when we don't sleep well, our mood is affected, our energy is affected. People who have pain, their pain scores are higher, and sex drive is affected negatively as well. Sleep issues can be a common symptom with age, and in menopausal women, they can be correlated with hot flashes. So sometimes hot flashes or night sweats are what is affecting a woman's sleep. So we want to improve our sleep. So avoid nicotine, alcohol, but you may say, well, wait a minute, if I have a glass of something, then I fall asleep so well. But I'd say that probably at 2 o'clock or 3 o'clock in the morning, you're going to wake up and you're just going to be really tired, but you're not going to get back to sleep because alcohol is really disruptive to the sleep architecture. How we sleep. It fragments our sleep. Decongestants. So I'm talking about cold medications here. Cold medications can be stimulants. So if you have a cold, you want to avoid decongestant towards bedtime. Sugar is a stimulant. Caffeine, as we know, is a stimulant. And I would always recommend people not have a caffeine drink after 12 noon every day, because caffeine stays in your system for a fairly long time. For instance, half of a caffeine load is still in your system 7 hours after you've drank it. So if you have a coffee at 2 o'clock in the afternoon, 7 hours later, 9 o'clock p.m., you're still going to have half that caffeine load in your system. If you're a woman who's having hot flashes or night sweats at night, get some answers to help those out. Exercise daily. There are lots of studies that show that people who do incorporate daily activity into their schedule do sleep better. But be careful, don't do vigorous exercise towards bedtime, because that would be stimulating. Sleep apnea. Have you heard of sleep apnea? Sleep apnea is a condition of upper airway collapse during sleep, and it affects sleep quality. So you may have sleep apnea if you're a loud snorer, if you have difficulty staying asleep, if you have daytime sleepiness, if you're irritable, if you have episodes of where you stop breathing during your sleep, and usually that's witnessed by your partner. If you have abrupt awakenings. Now, many people with sleep apnea are overweight, but thin people can get it too. And there's lots of studies that show that sleep apnea has a negative effect on sexual desire. For instance, that in this study that I'm showing, there was 43 premenopausal women and 58 postmenopausal women, all who had obstructive sleep apnea, and all of them filled out the Female Sexual Function Index. What was found was the women who had severe obstructive sleep apnea were found to have significantly lower scores on the sexual function index compared to those who did not have severe sleep apnea or in the control group. So have this checked if you're suspicious that it might be part of your issue. Some sleep hygiene. Yeah, sometimes our sleep hygiene isn't very good. We want a dark bedroom. You want a cool bedroom, not hot. No TV. Don't be watching TV in bed. No electronics. So don't be answering emails on your iPad, all of that stuff at bedtime. Try to have a regular bedtime, a good schedule, with no napping in the afternoon. And there are proponents of turning off your Wi-Fi at night. A few supplements that can be used that are non-addictive and can be very helpful. One is magnesium. Anybody who knows me knows that magnesium is one of my favorite things. I've been known to be at a party and be extolling the benefits of magnesium to anybody who gathers around to listen to me. Magnesium is relaxing. Most people are deficient in it. It can help us sleep. Melatonin, which is a hormone that our bodies make. We make less melatonin as we get older, and we certainly make less melatonin because we have lights. Okay, the lights that we have at nighttime, they decrease our production of melatonin. So that's one reason why sometimes we don't sleep very well. 5-HTP is a supplement that can help us to make serotonin, which is relaxing. But what about sleeping pills? I'm not going to go into too much depth about the sleeping pills, but what I will say is they're okay short term. So if you're in the middle of a really troubled sleep cycle, they can be used short term to sort of reset you. But longer term, there can be risks. So there can be risks of daytime sleepiness. There can be risks of cognitive issues, so how your brain works, that can be problematic. There can be risks of addiction, not being able to get to sleep without them. So they're not going to be the long-term answer for people. In fact, as we age, our senior population, they don't do very well with these drugs. It can really affect their cognitive abilities and increase their risk of falls. Okay, stress. Who out there can put up their hand and say they have no stress? Again, I think that there wouldn't be very many hands raised. We live sort of in a stressful 24/7 type of environment. Maybe you're raising kids, or there's financial difficulties, or your job is really stressful. Maybe you're caring for elderly patients, or not elderly patients, but elderly parents. Maybe you have a long commute in rush hour traffic every day. And that's just so many layers of stress. So think about stress. You're really stressed. Are you thinking about sex? Are you fantasizing? Are you thinking, gee, I can't wait to get home and have sex? In most cases, the answer to that would be no, because stress increases your body's level of cortisol, which is our stress hormone. And cortisol certainly plays a role in our bodies, but constant high cortisol decreases libido. Stress adversely affects all aspects of our health, like this chronic stress does. So, it decreases our mood, it increases our risk of diseases, increases blood pressure, keeps us from sleeping really well. So stress is problematic in so many ways, and it makes menopausal symptoms for women worse as well. So when there's a lot of stress, women's hot flashes tend to be worse. So what I'd suggest is make stress management really a high priority. So think about meditation. There's lots of apps on the internet on how to meditate properly, or join a group, or just simply practice deep breathing several times a day. And for 2 minutes, breathe deeply in and out, sort of like babies would. Little babies breathe so well. They really breathe with their bellies. So deep belly breathing. Try yoga. Go outside. There's a saying that fresh air is God's Prozac. I love that. A slow walk, just a gentle walk. Any kind of things that make your stress level come down are great. And there are some stress reducing supplements out there as well that we can help you with. Okay, I was going to talk about exercise. We don't move as much as we used to. I want you to imagine somebody who's really sexy. Somebody who you think is really sexy. Do you think that they're just, that person you're imagining, are they just sitting around on a couch doing nothing? Just sitting there all the time? No, you're probably imagining that they do move, they've got some energy and they're moving. We're meant to move. Our ancestors moved. They were farmers and hunters and gatherers, and we don't move enough. There's that saying that sitting is the new smoking, and I think that's true. So here's some recommendations for exercise. A minimum of 30 minutes, 5 days per week of moderate intensity, and we're talking about a brisk walk, or biking, swimming, dancing, something that gets your heart rate up a little bit. Resistance training for a minimum of 2 days on non-consecutive days per week. Here's some sobering stats. In Canada, only 15% of women aged 40 to 55 are considered sufficiently active, and only 72% of women over the age of 74, or I should say 72% of women over the age of 74 are inactive. And I imagine the stats for men are comparable. Studies show that women who engage in more physical activity report a higher level of sexual desire, and orgasm problems are more likely among women who report no physical activity. Think about when you've exercised, you've been out, you've done something. Don't you feel better? Exercise actually increases our testosterone levels a little bit. Exercise has been shown also to alter the gut microbiome in a positive way. Remember how I've said that gut microbiome is so important. I've got to put a plug in for yoga. It's one of my favorite things. From the Harvard Medical School letter, April 2010, they took 40 healthy women, most married, all sexually active, to do 1 hour of yoga daily for 12 weeks. And they found improvements in desire, arousal, lubrication, orgasm, overall satisfaction, particularly in those women who are over 45. 75% of the participants reported greater satisfaction with their sex life following yoga training. I've had clients who do yoga together, partners do yoga together, and they were doing it for stress relief, and they found there was a side effect of increased sexual desire. How cool is that? I found that amongst several people. Men, yoga is not just for women. There are so many men in yoga studios now, and there is a yoga studio near you, and you'll be surprised at how it helps with stress and how it can help with your overall health and your libido too. So we did talk about how hormones are a piece of the puzzle, and yes, they are a piece of the puzzle. So I tell women that their thyroid, every woman over the age of 40 should have their thyroid checked. And the reason for that is that thyroid disease is common and it increases with age. Symptoms of low thyroid can be fatigue, sleep disruption, mood issues, low libido, forgetfulness, dry skin, menstrual irregularities, and feelings of brain fog. If thyroid is not working properly, it's hard to get other hormones to do the job that they're supposed to do. So thyroid is like the master conductor. It's so important. Now, menopause does contribute to sexual function changes. There's decreases in ovarian hormone production, but the effect varies from woman to woman. And I see this. I can see women who have, normal high levels of hormones, but who have low libido. And the opposite can be true. Women who have low levels of their hormones, but their libido is great. They have no issues with it. So something's going on. There's more factors than just the hormones. When there's hormonal issues, it's decreased estrogen that's primarily responsible for a lot of the changes, but testosterone can be important too. Women, we need a little bit of testosterone sometimes, certainly nowhere near as much as men, for motivation, for desire, for sexual sensation. Testosterone is important for male desire and function because testosterone is the hormone of males. Now, in terms of safety, what do we know now in terms of safety? Well, in 2002, that landmark study, the Women's Health Initiative, showed that synthetic hormones, emphasizing synthetic hormones, initiated years after menopause, increased breast cancer risk and heart disease risk. Women everywhere stopped their hormones. It was a study that was surprising, showed negative things, so women everywhere stopped their hormones. And then there was a gap for years where women didn't know what to do. Well, the KEEP study in 2012, the story had evolved. This study showed that initiating hormone replacement, which is bioidentical, different than synthetic, soon after menopause did not increase these risks. And the KEEP study also showed that transdermal estrogen improved arousal and desire, plus helped night sweats. So that helped with sleep and menopausal symptoms. So it was initially thought that, okay, hormones, fine, small amounts for maybe 5 years. Then the story said, well, maybe 10 years. I'll read this to you. This is the North American Menopause Society's 2017 position statement on hormone therapy. And this is about duration of treatment. So it used to be, 5 years of hormones, okay, 10 years. This reads that hormone therapy does not need to be routinely discontinued in women aged older than 60 or 65 and can be considered for continuation beyond age 65 for persistent vasomotor symptoms, that's hot flashes, quality of life issues, prevention of osteoporosis, after appropriate evaluation and counseling the benefits and risks. An annual reevaluation should be considered. So again, the story on hormones is evolving. So let's talk about the role of testosterone in women. Like I said earlier when I started, some people have come saying, I've got low libido, so I just must need testosterone. Well, let's talk about that. Testosterone in women, levels begin to decline in our mid-40s, but earlier if there's nutritional deficiencies and stress. But by the time a woman reaches age 70, levels are half of what they were in their early 20s. But there's no abrupt decline like there is with estrogen at menopause. We still have testosterone later in life. It's there. Not all women with low testosterone levels experience sexual symptoms. Very true. Many women with sexual symptoms have normal levels of testosterone. So there we go again. Female sexuality is complex. What about men? With men, the decline occurs from their late 30s onward, but levels have declined 15% from 1987 to 2004. Well, why is this? Because we live in a somewhat toxic environment. There's bisphenol A from plastics, toxins and pesticides, and all these things have been shown to interfere with hormone receptors. Weight gain and sugar, spoke of that already. They increase insulin levels, right? Insulin levels, when it's high, libido can be negatively affected. Sugar affects the Leydig cells. So the Leydig cells are what produce testosterone. Lack of sleep has a direct negative correlation. Stress is adversarial to testosterone, and some medications that can be used can decrease libido and testosterone. So with testosterone, I want to emphasize we get other things in order. Get your stomach in order, get your sleep in order, get your stress in order, exercise. In women, balance that estrogen and progesterone, work on diet, lifestyle, your stomach, and see if testosterone is needed. And if testosterone is needed, it's usually not very much that's needed. For men, have your testosterone levels checked. Levels have declined for the last little while, and men do go through their own andropause like women go through menopause. So if you're feeling, like your mood is affected, like you're gaining weight around the middle, that you've lost muscle mass, all of those things, have your testosterone level checked. Testosterone's effects are increased libido and energy, enhances well-being, helps strengthen our bones, and helps promote muscle tone, and that's in men and women. Big long word, the genitourinary syndrome of menopause. What I'm speaking about here is changes in vaginal tissue, so dryness, discomfort in the vagina. Estrogen is important for women, and once we lose it through menopause, lots of things are affected. One of them is vaginal health. So estrogen keeps the environment of the vagina good. It keeps it elastic so that it can expand. It keeps the tissue from being too thin. It keeps the pH where it's supposed to be. So after we lose estrogen, things change. And this affects approximately 1.6 million postmenopausal Canadian women, but only 1 in 5 will discuss it with their doctor. Symptoms can include discomfort, pain with intercourse, bleeding, urinary frequency, and vaginal and urinary infections. And I'll pose to you, if you are having, an issue with, discomfort and pain with intercourse, how likely are you going to be to want to have sex? Not very likely. In women, this is from Menopause Journal 2018, January. In women, lubrication problems have to be adequately evaluated and treated to achieve a better sexual life. So what are some vaginal health tips quickly? If you're a smoker, think about quitting smoking. Smoking is drying and irritates tissues. Vaginal stimulation. This is true. Use it or lose it. From Clinician's Guide of Menopause, regular sexual activity promotes blood flow to the genital area and can help maintain vaginal health. Right? So we want to continue to use it, or else it really changes and it's harder to get back. Avoid harsh soaps and irritants. Avoid antihistamines, which can be very drying. So that's allergy medications. A little bit of vaginal estrogen by prescription. So just low dose estrogen applied to the vaginal tissues can really help to bring that environment back. It helps with lubrication. It helps to plump up the cells, helps the pH. So this is prescription only, and your doctor or your naturopathic physician can prescribe this. And it's only used usually a couple times a week, but can make all the difference. You can use as needed lubricants, but be sure to ask if what you're going to use matches the pH of the vaginal tissue, because otherwise it can be irritating. Vaginal moisturizers, there are some available commercially, and a vaginal moisturizer just provides a little bit longer moisture than a lubricant will. And some of them on the market, there's Replens. At Nutrichem, we have our own called Nutriplens, and with it, we've taken out the yucky chemicals, the parabens, etc. And there is a vaginal ovule called Repagyne, which is helpful as well. There are drugs that can negatively affect your libido. Some of these categories, antidepressants. Antidepressants can have, a negative effect on libido, and it's interesting that sometimes when women go through menopause and have hot flashes, they get offered an antidepressant to treat the hot flashes. And the reason is that there are studies that show that certain antidepressants in low doses can provide relief of hot flashes, not to the same degree that hormones would, but they can decrease the frequency and severity of hot flashes. But it's interesting because I find that the women I see often have hot flashes and some desire issues as well. So giving them an antidepressant seems kind of counterintuitive, right? Seems to, not necessarily be the best answer. Antipsychotics can do it. The birth control pill, cholesterol-lowering medications can decrease testosterone levels in both men and women. Some blood pressure medications, alcohol, as I spoke of, and marijuana. Marijuana in chronic users has been shown to decrease testosterone. Now, I'm not saying to stop any medication. I never want people to abruptly stop medication. But if you're thinking that, I wonder if it's my medication, talk to your doctor or pharmacist and see if it could be the medication, then it could be an alternative for you. Oh, what about women's Viagra? Because this has been in the news in the last year or so. Women's Viagra. So this is from Menopause Practice, a Clinician's Guide. Viagra at daily doses of 10 milligrams, 50 milligrams, 100 milligrams did not improve sexual response in peri or postmenopausal women with sexual disorders. It didn't. Not a big surprise, because as we've looked at, desire has many different factors that affect it. So thinking that one pill was going to do it, I'm not surprised. Women's Viagra, it has been shown to possibly benefit women who develop problems with arousal or orgasm who are taking antidepressant SSRI medications. Still has to be looked at more, I think. There's side effects of headaches and hot flashes as adverse effects. So not necessarily, especially the hot flashes for women, not necessarily desirable. There are nutrients that can be helpful for libido. And again, I'll post to you to get everything else working before you think that nutrients are going to be the only answer. But zinc is important for testosterone. B vitamins are important. Vitamin C, magnesium, again my favorite thing. It can play a role in testosterone production, helps us to make serotonin, it relaxes us. And so you may want to look at a good multivitamin and maybe a magnesium supplement. A herb called tribulus. This was from Menopause, November 2016. It was found that tribulus might be a safe alternative for the treatment of hypoactive sexual desire disorder in postmenopausal women because it was effective in reducing symptoms with few side effects. Its probable mechanism of action involves an increase in the serum levels of free and bioavailable testosterone. And tribulus is available in some commercial products. Ashwagandha. This is an herb that's used to decrease stress and support the adrenal glands, but oral administration has been shown to possibly improve sexual function in women. Ginseng may help improve sexual function in both men and women. And maca, treatment with maca improves sexual desire in men, but without raising testosterone levels. So they're independent of the testosterone levels, and that's from the Journal of Endocrinology in 2003. Oh, your relationship with your partner. This one's important, and I certainly don't pretend to be any kind of relationship counselor, but this is important. It's been shown that sexual distress inversely is associated with better communication of sexual needs. So the more we communicate our sexual needs, the less sexual distress there'll be. Melbourne Women's Midlife Health Project. This found that a major factor in affecting women's sexuality was closeness to their partner. And we need to feel a bond. We need to feel closeness. If we've been in a relationship long term, that can affect it. So you got to get creative and change up your routine. Develop some emotional closeness. Go for a walk together. Turn off the social media and the emails, etc., and forge that closeness. Date nights. Maybe make a plan. A weekend away if possible without the kids. Increase the communication. Change your sexual techniques. Maybe some sex toys. You can get a little bit creative with this because, as we know, there's benefits of a good, healthy sexual relationship. So the final answer, you might think it's complex. And I've gone through lots of factors saying it might be complex, but it's actually not. It's actually kind of simple. Basically, we're getting back to basics. Hippocrates said, that all disease begins in the gut. So what we eat and our gut health, I'm hoping I've hammered that home. Losing weight if needed. Like I said, if you eat healthily and cut out sugar, the weight comes off just as a side effect of that. Exercise, improve your sleep, decrease your stress. All of these improve all aspects of health. If you're a woman, balance the estrogen and progesterone and see if you might need a little dose of testosterone. For men, see if maybe you need some testosterone. Work on your relationship and get the answers that you need. And like I say, we're happy to answer questions or meet with you. Thank you very much. And I'm happy to take any questions that you might have. I think we've come to just about the hour that I was anticipating for us. Okay, here's a question. I've tried testosterone, but it affected my skin. I got some acne and I gained weight. Yes. Like I said, women don't need very much testosterone if needed. I'd say chances are you had too much of a dose of testosterone because high testosterone can cause acne issues and can cause weight gain. So, it'd be good to look at that dose and see if it was too high. Chances are that it was. What are the risks or side effects of hormones? Side effects of hormones are usually just if the dose is not right. So if women get too high of an estrogen prescribed, the breasts can feel tender. You can sort of feel irritable. And, you know, you can have a vaginal bleed if the estrogen's too high and progesterone's not adequate. So it's usually, if you don't feel right on a hormone, that's a sign that the dosage is not right for you. So really, in terms of hormone therapy, we would look at how you're feeling clinically, and then just, you know, check every now and then to see that hormone levels are in the safe range, that things look like they make sense. You know, but basically, it's a clinical picture of how you're doing clinically, and then a safety thing of where are the levels. I hope that's answered that question. Okay. What location do I work out of? I work out of Richmond Road, which is the Nutrichem store on Richmond Road. It's between Pinecrest and Woodruff on the north side of Richmond. That's where I work, and I work in the dispensary on Thursdays and Fridays. So you can always find me there on Thursdays and Fridays from 9 till 6. I work one Saturday a month, and it varies. But on Mondays, I'm usually in the clinic meeting with patients to talk about menopause and help work with them. Our other location of Nutrichem on Saint Laurent, it's a satellite location. I don't work out of there because it's not really our main location, but it's a satellite location. So our naturopathic doctors work out of there, and we also sell some supplements there as well. But the dispensary, the pharmacy, is located on Richmond Road, and that's where I work out of. Can I get a copy of this? My presentation is, I'm hoping that it's going to be on our website. I'm hoping that it recorded properly. I'm of the vintage where if something can go wrong technically, it probably will. So I'm hoping that all worked out. So it should be up on our website in a matter of no time at all. So you can check there. And if not, contact me and I can send it to you for sure. Okay. Looks like that's all the questions for now. And like I say, since I've used up the time, then I'll say good night, and I'll say thank you so much. I'm so honored that you joined me and you listened to this. And if you have any questions, please contact me. This is what I'm absolutely passionate about, is answering questions and talking about this subject. So really, thank you very much, and have a good evening. Bye-bye.